So, have you ever stopped to think about how an entire country builds a roadmap for better health? I mean, not just for a few people, but for every single citizen? Well, today, that's exactly what we're digging into. We're going inside Malaysia's really ambitious new plan to totally rethink what quality healthcare is and how to actually deliver it. And this quote right here from Malaysia's Director General of Health just sets the stage perfectly. The key phrase you gotta hang on to is bridge silos. It points to this huge challenge you see in healthcare all over the world. You've got all these different departments, clinics, and hospitals working really hard, but they're not always working together. This new plan is all about changing that. And that really is the million-dollar question, isn't it? When you've got this mix of public hospitals and private clinics and so many different programs already running, how in the world do you create a single, clear vision for quality that everyone can actually get behind? Let's break down how Malaysia did it. Okay, so first things first, we have to understand the why. Why was this whole national policy so critical? The problem wasn't a lack of effort. Far from it. The real challenge was that all those efforts were kind of fragmented. There were tons of great ideas out there, but they needed one big banner to unite under to really start making a huge difference. And the stakes here are just massive. Globally, the cost of poor quality care is, well, it's staggering. We're talking between 1.4 and 1.6 trillion dollars lost every single year in productivity, and that's just in low and middle income countries. But this isn't just about money, right? It's about the incredible human potential that's wasted when healthcare doesn't measure up. Now, what's really eye-opening about this slide is that it shows this is a universal problem. It's not just in one part of the world. In low and middle income countries, a shocking 60% of deaths from treatable conditions aren't because people couldn't get care, but because the care they got was poor. And get this, even in high income countries, 1 out of every 10 patients is actually harmed during their treatment. This data just makes it crystal clear. Boosting quality is one of the most important missions in healthcare today. So at the end of the day, what it all boiled down to for Malaysia was this. They had all these different quality improvement initiatives, but they were all kind of operating in their own little worlds. The real goal was to connect the dots, to build a national framework that could get all these efforts from both the public and private sectors rowing in the same direction. So, how do you even begin to build a framework that big? Well, the answer is in the super careful and deliberate process they used to create their National Policy for Quality in Healthcare, or NPQH. And this wasn't something that just happened overnight, not even close. The whole journey kicked off way back in January 2019 with some really meticulous planning. A huge moment was in July of that year, when they held a workshop that brought all sorts of different voices to the table. By early 2020, they were checking their progress with international experts. And finally, after years of work, the policy officially launched in October 2021. This timeline just shows you how thoughtful and collaborative they were. And this slide, this is where the real groundwork was laid. It was all built on this deep situational analysis. First, they looked at all the data they had, past and present. Second, and this is so important, they talked to everybody, from government folks to private doctors to the public. And finally, they took all that info and used it for a SWOT analysis to really nail down the policy's biggest priorities. So all of that hard work, all of that listening and research, it led to the policy's central breakthrough, creating a brand new shared definition of quality that everyone, and I mean everyone in the healthcare system, could understand and aim for. You see, for a long time, there's been this kind of divide. On one side, you have technical quality. That's the system's point of view. Was the surgery successful? Was it medically safe? Then, on the other side, you have experiential quality, and that's the patient's view. How was I treated? Did I feel heard? Was it a frustrating process? For a system to be truly great, it has to nail both. And here it is. This is the big idea that bridges that gap between the technical and the personal. The policy introduces this brilliant framework called STIPA. It defines quality care as being safe, timely, effective, equitable, efficient, people-centered, and accessible. This one acronym, it creates a clear, complete, and shared language for what good looks like. It's really the heart of the whole thing. But it goes even deeper than that. The policy actually builds core human values right into the definition. It says quality care has to be delivered by a team, and it has to be done in a caring and professional way. And what's the end goal? To improve not just health outcomes, but the patient's actual experience. It's about combining the science of medicine with the art of compassion. Okay, so you've got this awesome new definition in place. Now what? How do you actually make it happen? Well, let's take a peek at the action plan, which is all built around 7 strategic priorities. The way they've structured this is actually pretty brilliant in its simplicity. You've got that steepa definition of quality sitting right in the middle, at the core. And holding it all up are these 7 strategic priorities. These are the pillars that are going to turn this vision into real, concrete action across the entire health system. Now, we won't go through all 7, but let's just touch on a few of the big ones. First, improving integrated people-centered services, basically making sure your care is coordinated around you. Second, strengthening the culture of quality among all staff, so that being caring and professional is just second nature. And third, boosting communication to make sure that patients and doctors are truly partners in care. So this all sounds really good in a high-level policy document, right? But let's bring it right down to earth. What does this whole ambitious plan actually mean for you and your family? Let's just ask the question straight up. What difference is this all going to make the next time you have to walk into a clinic or a hospital? At the end of the day, it means they're building a system that doesn't just treat an illness, but treats you as a person. It's about aiming for care that's coordinated, so you don't have to tell your story a million times. Care that actually listens to what's important to you. And most fundamentally, care that is safer and better for every single person. So there you have it. Malaysia has put in the hard work to create its roadmap, bridging those silos to create one unified vision for quality healthcare. It's a huge achievement. But, just like any map, the paper it's printed on is just the beginning. The real journey, the journey of putting it all into practice, of changing cultures and of always getting better, that journey starts now.